As we honor October, Breast Cancer Awareness Month, it's my privilege to introduce the founder and CEO of Leafwell, Emily Fisher, who embodies the spirit of resilience and dedication in the fight against this disease. Emily is not only a breast cancer survivor, she's a passionate advocate for breast cancer awareness, but also a tireless supporter of patients and their families. Her work in advocacy research has made a significant impact on countless lives. And today we have the opportunity to hear from Emily in an interview that will highlight her journey, her insights, and the vital importance of continuing our efforts to support those affected by breast cancer. Thank you, Emily, for joining me today.
Dr. June, it's always a pleasure. Thank you so much for having me.
Well, I would love to begin with your story um, and talk about perhaps how you can share, what the initial diagnosis was, the treatment plan for your breast cancer, and what was it like when you were first diagnosed? Talk about, some of these challenges that you faced.
Sure. I was diagnosed with breast cancer when I was 26 years old. And, I think the moment of getting the diagnosis, it felt like being sort of hit by a ton of bricks. You're just sort of um, winded, I suppose. I remember I sort of just started crying. You obviously have hundreds and hundreds of questions running through your mind and no answers, at least not right away. During those first couple of months, I just sort of threw myself into work. So I would get up, go to work, leave work early, go to the hospital, have radiotherapy, take myself to bed. And I did that every single day. One thing I will say is that part of what motivates me to really tell my story is that for probably the first couple of years at least, I felt a great sense of shame and even guilt for getting the diagnosis. I sort of thought, what have I done? What did I do? What mistakes have I made? What bad choices have I made that sort of led to this diagnosis? And I realize now that that's silly, that I should never have felt that way. And, cancer touches so many of us. And so it's really what drives me today to speak out. That hopefully if someone else is going through similar experience that I went through, this can help them in some way.
Wow, thank you. Thank you so much for sharing that. Um, so, so you didn't use medical cannabis during treatment. So when did you first learn about medical cannabis, and how did that come about?
The cancer diagnosis sort of sparked a, a real sort of passion in me, a deep interest in sort of understanding my health holistically. And so and this is linked to my cannabis journey. So part of, getting the diagnosis, I started reading a lot into, health and thinking about sort of nutrition and mental health and emotional health and really sort of thinking about health holistically. And interestingly, I couldn't even talk to the healthcare providers, my doctors during treatment about some of the questions I had going through this sort of this journey, reading sort of different books. They couldn't answer questions about what my nutrition should be like, or even what birth control I should be on. My experience with medical cannabis happened years later, and I would say that I was skeptical to say the least. So when I first heard, obviously I'm English, and back then I started my cannabis career in 2016. At the start of 2016, there was no legal framework in the UK for medical cannabis, and so when I first heard about this, I was skeptical. That really evaporated when I spoke to the very first patient and heard about how cannabis was helping them, and really how it was changing their life for the better. I went on to work in cannabis in California, and during that time met hundreds and hundreds of patients who shared their story. And a lot of the patients that I came across found cannabis as a last resort, so they had to go through, just really heartbreaking journeys, and find their information in sort of dubious places. Their stories opened my eyes and opened a new world to me in terms of medical cannabis. And so this was about 6 years in. I'd had lots of surgeries, I'd been taking lots of painkillers, and I ended up in ICU in LA. Didn't realize at the time, but I was bleeding internally. And so I was rushed into ICU. I had to have 4 blood transfusions. I had an emergency operation, and I was on some very strong painkillers. And the painkiller's fantastic when it's working, but when it wears off, you're in excruciating pain. I remember that as I'd been visiting sort of dispensaries at the time, I bought a tincture from one of the dispensaries that I'd been visiting. And, I was in so much pain, they wouldn't give me more painkillers. So I decided to take a little bit of the tincture. And it felt like almost immediately, it felt like someone had turned down the volume on my pain. And I drank a bit more and I drank a bit more and I ended up drinking the whole bottle. And my pain went from a 10 to a 0. And it was incredible. I was ecstatic. I sort of told my surgeon about this. Unfortunately, my second experience was almost exactly the opposite of that. So I was let out of hospital, and I didn't have any more product left, and the pain started coming back. So I went to a dispensary, bought some products, tried a few products. It wasn't working. Decided to take a bunch of an edible, and then end up having one of the scariest nights of my life. Ended up literally sleeping by the toilet, vomiting all night long. So that was my second experience with cannabis. So you can imagine. But all of that, played an important role in inspiring us to start Leafwell.
Wow. Thank you for sharing that. So, I would say, looking back then, I mean, that's quite a journey. What advice would you give to patients who are thinking about medical cannabis as part of their treatment, or maybe another serious illness?
We say at Leafwell that cannabis is like a pharmacy in a plant. In fact, out of the 400,000 patients to date, we've seen over 400,000 patients. They've reported to use cannabis for over 100 different conditions. So you can just imagine, um, just sort of how versatile this plant is. But like with my second experience, it can be unreliable. And so, my what we advocate for Leafwell, and the advice I always give people, and it's easier said than done, but it's certainly what we're trying to lead the way in at Leafwell, is if you can speak to a knowledgeable healthcare provider. I advocate for doctor-led care, because cannabis is a medicine. Not everyone should be taking cannabis. There are drug interactions that people need to be aware of. If possible, speak to a knowledgeable healthcare provider who can provide the sort of guidance, so that you can get the outcome that you want. The other thing that I would say is be proactive. Unfortunately, this is where we are with cannabis today. We might not always be in this place, but in order to get the best outcome, you may need to try different products. You may need to try different dosages. And people aren't used to approaching medicine in this way. They're usually passive about the way they take medicine. They go to a doctor. The doctor says, take this pill, take it 2 times a day. You don't have to think about it. That's not how you can, that's not necessarily the best way to approach cannabis. So I would say be prepared to try different products. You'll need to be proactive. Try and find a knowledgeable healthcare provider, and obviously Leafwell provides that resource. But I think this is so important. And then, on the other side of that, if people do that, cannabis can be an extremely powerful and effective tool for so many different types of ailments. It's really exciting, the potential it has as a medicine, and I think that we've really just scratched the surface there.
Thank you. Thank you.
It's really a pleasure to talk to you, and I'm very fortunate to be able to work with you on a day-to-day basis. But I think it would be a missed opportunity, as you're one of the leading experts in cannabis care, not to ask you some of the frequently asked questions that patients ask us. So may I ask you a few questions?
Sure.
I'd love to ask how medical cannabis can help manage chemotherapy side effects like nausea, vomiting, and loss of appetite.
That's a great question. Medical cannabis can help reduce nausea and vomiting, as well as boost appetite during chemotherapy and radiation. So, how medical cannabis works is that it works with the body's natural system that controls nausea and our hunger hormones. So, sometimes traditional medications, so we'll prescribe Zofran, for example, which is an anti nausea medication, that can actually cause constipation. So if you're constipated and you're not having normal bowel movements, your appetite's going to get affected. And then
Mm.
normally we will give another prescription medication to deal with the constipation, right? And a stool softener, if you will. But that can lead to more issues like diarrhea. So medical cannabis is actually a natural way that can break this cycle, and it offers relief for nausea, vomiting, and loss of appetite. So I can give you 3 or 4 different prescription medications, sure. Or we could eliminate those 3 or 4 prescription medications and just try medical cannabis.
One of the questions that we get asked most is it safe to use medical cannabis during treatment, like radiation or chemotherapy? And then who should actually avoid it?
So using medical cannabis, during treatments like radiation or chemotherapy can offer some benefits, but it does come with risks, just like you had talked about. So the safetyness, the appropriateness of medical cannabis in cancer treatment depends on different factors, right? We have to think about the type and the stage of cancer. We have to think about the specific treatments being administered and the patient's overall health. So their age, for example, you brought up, if you're an elderly patient versus a young patient with no other comorbidities, no other diseases. That makes a difference. It can increase appetite. So, patients that are going through chemo and radiation, we don't want them to lose weight. We really need their body to be strong so that they can handle the cancer treatment. So, appetite stimulation is very, very important. And then there's anxiety and sleep issues. Sometimes when patients are on chemo, this is the analogy that I always get. They say, Dr. June, I feel like I took like 10 cups of coffee. I feel like I'm on an energy drink. Like I'm exhausted, but I'm buzzing inside and my mind is racing. I'm thinking about so many things of what can happen, what may happen. Is this going to work? So medical cannabis can reduce that anxiety and improve sleep quality, which affects
Mm.
how you're going to be able to handle treatment. So these are things that are super important and will help the patient get through chemo and radiation. But then I mentioned, there are risks and considerations. Cannabis may interact with certain cancer treatments. So you want to make sure that you work with a knowledgeable oncologist and a knowledgeable cannabis expert so that we can work together as a team to make sure that there's no interaction with certain cancer treatments. Also, a lot of patients find it helpful to use cannabis during the pain and inflammation on the skin during radiation therapy. So they might use a topical. It might help in wound healing. Like if the skin feels raw and it's difficult to put on, a bra, for example, or a t-shirt. Sometimes topical cannabis medicine can help with that as well.
Finally, would you be able to give folks listening how they can have, or advice on how they can have informed discussions with their doctor or oncologist about how they could incorporate cannabis into their treatment plan?
Yes. Patients should openly ask their oncologist about medical cannabis. Don't be shy about it. Bring up research. Check out our Leafwell research dashboard. Any specific symptoms that they want to help with. And if their oncologist isn't familiar with cannabis, that's okay. They can consult with an integrative oncologist through Leafwell who might work alongside their local doctor. We want to start with low doses. We want to gradually increase if needed. There's different methods of administration. Do I use a oil, a tincture? Do I use an edible? Do I use a smokable form? Right? They all have different onset times. They have different duration of effects. So it's a lot complicated than we think. And when you're going through chemo and going through radiation, you really need to be supported about all that. It's not easy just to walk in to a dispensary and just pick something off the shelf. It's nice to have support from a health provider that can give you a protocol, that can give you a regimen. This is how much dose you should start with. This is the formulation you should start with, and to say, I'm going to help monitor you. I'm going to work with your oncologist and adjust as needed. It's a dynamic process. The first treatment, the first chemo is going to be very different from the number 3 session, as you know, to the number 10 session. Your body's going to change, your weight's going to change, your appetite's going to change, and your oncologist and cannabis specialist should work in tandem to support you every step of the way.
Thank you, Dr. Chin. That's really fantastic. One of the things that I heard from patients over and over again is that I feel when I take cannabis, I feel back in control. of my life. And to be able to discuss that with your doctors, with your oncologist, I think is extremely powerful and will go a long way to supporting patients through a very difficult time.
I think the most fulfilling aspect of being an integrative physician is seeing patients who have reached their limits of conventional medicine, and then they find a renewed hope and belief through cannabis medicine. So this means, helping some patients reclaim their quality of life. Maybe a cancer patient tried everything and their taste buds are just, are affected and they just don't want to eat anymore, but they use a gummy edible and that hamburger or that salad just tastes so good again, and their favorite foods, right? They just have that enjoyment again for eating. That makes a huge difference in cancer treatment, right? We are empowering patients with choices. We see them regain control over their health, just like you said, and really make a tangible difference in the lives that once felt hopeless.
And that should be accessible. That should be available and accessible to patients.
Well, I mean, to wrap it up, are there any last minute thoughts or takeaways that you want our community to understand about medical cannabis, breast cancer, patient caregiver support?
We have this incredible opportunity to learn more about this amazing plant, this plant that truly is a pharmacy in a plant. In order to do that, we need to follow the science. We need to do more research. We need to understand its utility as a medicine. We need to also understand its safety profile better. We need to understand the adverse events that people are experiencing, like the one that I experienced the second time that I used cannabis. If that experience had happened to an 80-year-old, it would have been terrifying for them, even more terrifying than it was for me. So I think all of these things are truly important. At the same time, I think increasing access, patient access is truly important. One of the things that inspired Leafwell is that everyone that I met during those first few years found cannabis as a last resort. And that shouldn't be the case. It should be considered much earlier on in the treatment plan, and it can be so complementary to conventional medicine if sort of taken responsibly and optimally. So I would say, what the three pillars that we stand for at Leafwell: access, education, and research. I would say those pillars are more relevant than ever today, and I believe will continue to grow in relevance as regulations open up and more people start thinking about using cannabis as a medicine.
Thank you.
No, thank you, Dr. June. For a lot of people, hearing from a healthcare provider is really what's needed after decades of stigma, to reassure them that this is something that could help them, to sort of give them the confidence to try it. So thank you so much for sharing, for answering those questions, for sharing your views and your insights, and for a really great conversation.
Thank you.